So I'm going to show you how to find a radial pulse in your wrist and a carotid pulse in your neck. So the carotid pulse is easy. You may have learned this when you did your CPR instruction in 8th grade. Your carotid arteries are on either side of your windpipe, right here in your neck, between your windpipe and this big tendon right here. To find it, put your fingers, these two fingers, in that valley and slide up or down until you feel it. You should feel a little pulse. This one is probably the best one to use, but it's a little personal to do on a stranger. So usually when you go to the doctor, you feel for the radial pulse. They feel for the radial pulse instead. The radial pulse is named after your radial artery, which is on the thumb side of your lower arm, next to the bone called the radius. And so this artery is right here between the bone and this big ligament right here. So to feel it, you use these two fingers, feel in that valley, and you may have to slide up or down. If you have trouble finding it, I just found mine right there. The other thing you can do is you can wrap your hand around this arm and use these two fingers like that. And if you have trouble finding it, slide up or down your arm. And you might have to push into your arm just a little bit. Some people's arteries are deeper than others. So once you've found it, then you can start counting and taking the pulse.